From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
Welcome to Veterinary Vertex, the AVMA Journal's podcast, where we delve into the behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. Today, we're discussing a study that compares clinical early incisional healing outcomes of TPLO incision closures when using reverse cutting or taper point needles for intradermal closure with the author of that manuscript, Josh Becker. Hey Josh, thanks for taking time out of your super busy schedule to be with us here today.
Yeah, absolutely. Thank you for having me.
So Josh, before we dive in, can you share a little bit about your background and what brought you to suture needle selection research?
Yeah. So as far as my research background goes, it kind of started in undergrad where I was first exposed to the ins and outs of research, like the whole research process. In vet school, I helped with some clinical research for a surgeon, mostly just like data gathering and organizing at school. And then I also helped with some animal ethics publications with a law school professor who also happened to lecture on animal ethics to the vet students and veterinarians. I co-authored a book chapter on single port minimally invasive techniques with one of my mentors during my surgical internship. And I've had a lot of fun fact, I still can't spell laparoscopic correctly like half the time. But I also participated in a few other projects and failed more times than I'd care to admit in trying to get some projects off the ground. But it's all kind of led up to just a fair amount of exposure to research. I just finished up my surgical residency. So research is something I've always kind of been interested in and hope to continue well beyond residency. And how that brought me to suture needle selection was because it's something that's been overlooked in the vet literature, and two, when coming from a busy private practice setting, it was a accessible topic for me to really look into without having to necessarily have all the fancy equipment and specialized tools that you might get in an academic setting or like a highly specialized setting. So it was something that like I could potentially get good data on and publish on while not necessarily having, all the cool bits to really get more facts.
Yeah, very clinically applicable. It's the first thing I ask people when they say, "Oh, could you help me design a research project? What's your interest?" And then they say what their interest is. I'm like, "Do you have the case number to support that?" So well done to identify that. It sounds like you got good mentoring early on.
Yeah, I was very lucky in that regard. So hopefully I haven't embarrassed them with this paper.
I think you probably found that luck. This JAMA article discusses how taper needles are non-inferior to reverse cutting needles for intradermal closure for TPLO. I'm a surgeon too, and I know that these needles are, especially for intradermal, people have strong opinions, shall we say. And I guess for me, I would have thought the difference between these was due to skin thickness, skin toughness, but what was your motivation for this research?
Really the lack of like empirical data out there in the vet literature, and even in the human literature, it's also kind of debated. Like you said, during my training, I had some mentors who had very strong opinions on the needle I ought to be using. But then because they had such strong opinions, it made me go like, okay, well, where's your proof? So I'd look it up and be like, oh, here's some papers that say this and other papers that say that. But the more and more you look into it, there's no one that actually has anything to be like, look, this is what, like, we tested this many patients and this is the outcome and this is why this is better. And in fact, there's contradictory papers and articles out there. So I was just like, let's try to actually pin something down here.
Yeah, I like it. You already said one of the factors when considering the design was that you had an adequate case number to support or refute your hypothesis. And then the next thing would be your outcome measures. How did you define and measure non-inferiority in this context?
Yeah. frankly, I think the use of the term non-inferiority from like a statistical standpoint is probably a bit of a misnomer. But the problem was that for non-inferiority studies, we need that like non-inferiority margin to define like, oh, deviation this much from the outcome is what you can call like inferior or not inferior. But because we didn't have an established, this is the correct needle, this is the standard. Um, it was more of a, even if we found something like we did in the paper, it was like, there's evidence to show there might be a difference. We couldn't be like, hey, this is something we should look into further, not necessarily like this is the better needle. So really it was more like, look, there's, especially in this paper, there was no difference in clinical outcomes, but we did find some statistical difference in the, 18 to 24-hour post incision check. So that we use the term non-inferiority. There's probably, in hindsight, a better way to state it, but for the sake of brevity for the title and honestly, just for the lack of my ability to figure out a better term, I went with non-inferior.
So which needle does Josh Becker use?
I do like the taper needle, at least with my TPLOs. In the paper, I do mention that it is probably different for different parts of the body. I mean, for an intact male, like an abdominal closure, I'm going with the cutting.
Yeah.
Because I've definitely bent enough of those during surgery just be like, all right, nope, not working. But here for TPLOs, yeah, personally, I've done enough TPLO intradermal closures at this point where I'm like, yeah, let's go taper.
Yeah, makes sense.
Yeah, this research is moving the needle. No pun intended.
That's terrible.
I know. I've been thinking about that for like the last 5 minutes.
Boo.
Bad jokes
From
apparently suck.
Only from a non-surgeon would use that.
Definitely non-surgeon over here. So Josh, what are some of the key take-home messages you hope veterinarians will remember from this work?
I mean, realistically, again, we can't say like this is the better needle. It's really our findings suggest that the taper needle may have a benefit in the context of TPL intradermal closures. That's a very narrowly defined window, but I think what may be cross applicable here is that thinking about all the little steps that you take in any surgery, every tool, every technique, everything we do, really, you need to think about it because it could have a difference in patient outcomes. So being able to tailor that to every patient, every situation will make you a better surgeon.
Yeah, I like that take home of being intentional with your choices. I think that's important.
Yeah.
And how can veterinarians integrate these insights into their daily clinical routines?
Kind of going into that same thought process, it's just mindfulness. Doesn't necessarily even need to be in surgery. Just, again, always having a rationale and ideally some empirically driven data that can inform your decisions and your decision making.
Hey, Josh, what's one lesson in life, doesn't have to necessarily be in the OR, that you learned the hard way? And how would you pass that on to surgeons? Again, it doesn't have to be surgical. It can be how to navigate a career, anything like that.
Honestly, it's easy for me to pick a surgical one because surgery is fickle, particularly soft tissue. Orthopedics, you have that you usually know you've done it right or you've done it wrong pretty immediately, which is very gratifying. But with soft tissue, you'd be like, oh, that was the best one I've ever done, and then it blows up in your face, and you're just like, oh God, what have I done wrong? You're ripping out your hair, just thinking of all the things you could have done better, or looking back, what did I miss? So I guess that one lesson would just be like, don't be too hard on yourself, but make sure you're thinking about everything. And really, when those things do happen, you got to do a good workup afterward to figure out why.
Yeah, I like that. With my veterinary students and my residents, when we were scrubbing, I would say, what did we do well last time on this surgery? What could we do better? And then when we're degowning or bandaging, and then the same thing, what did we do well? What can we do better? It could be communication, positioning, where were the radiographs? We didn't have something prepared. We didn't prepare with the technical team well enough. So I think being mindful and reflective, but don't be too hard on yourself.
Yeah. Yeah, I'd never done or seen a perfect surgery. There's always something that could be better. So that's a good takeaway for that.
Yeah, that is true. For veterinary students considering a surgical path, what advice would you give to them?
Work hard, study, be a good student your whole career, and just love what you do. if you're picking surgery, you should pick it because it's the coolest thing in the world.
It
So,
is.
yeah. Sorry, Sarah.
No, it's okay. I was going to say spoken again like true surgeons. So looking ahead, what are the next steps for research in this area?
Well, since we did find, some statistically significant data, I think really it's just being able to verify or disprove it at this point. We touched on it a little in the paper, but we should be thinking about how to find more objective ways to evaluate the differences, and verify that they exist or don't. And then what are the clinical implications of that? So, like I was saying, does it apply to different areas of the body? For the differences we do find, what does that mean for the patient and their outcomes? And really, how can we continue to build on that and apply it to better serve our patients?
And are there any gaps or limitations in current knowledge that you think should be addressed first?
Yeah, a big one would be particularly for my study, what I found was that there's no objective metric in vet med for wound assessment, like for incision healing. There's a couple smaller studies. I referenced a few that they came up with quantitative or semi-quantitative methods to try to objectively evaluate that. But there's nothing that's been validated in vet med. Like we have, the animal trauma triage score, the Glasgow-Coma scale, all of which have, further studies to be like, look, this works and is accurate. We don't have that in, on our side of the fence. Human medicine has at least one. I tried to rip as much from that as possible, but it's just not as cross applicable to veterinary patients because you're not asking them, oh, do you smoke? So there's less I can use for that, and so I think that would be a great line of research for someone to really figure out and give us that tool.
Maybe that someone can be you, Josh.
Maybe. I like the incision scoring system I came up with, but again, I would like some validation. And one idea that was tossed out that would have been really cool is maybe something AI driven or just computer driven based on the photos we took. And you quantify the length of the incision. You have it uh, standardized to the length, and then you can get like an area that's affected by like erythema, bruising, something like that, and you can get actual percentages. But again, then the same problem, you got to validate it and all that. So someone smarter than me with electronics might be able to figure that out. But
That would be super helpful too for postoperative care, icing, heat, mobilization, all of those things that we do and don't really know how much, even if it's increased vascularity or decreased, how does that affect wound healing? And Josh, you talked about the great exposure you had in undergrad and then as a resident. How did this training culminate and prepare you to write this article?
I think really the biggest thing it did was really help me troubleshoot all of the roadblocks we kind of encountered during the process. Um, there's a lot of things that's from a third party perspective when you're watching a study be conducted that you're not thinking about. And when you're actually doing it, you're just like, there's so many, and you realize how many intangibles you come up against just like trying to get the clinic flow, trying to make sure that, um, you know, you're gathering the data appropriately, that the patients are being handled appropriately, the clients are being handled appropriately. You're crossing your T's, dotting your I's, and um, yeah, that was as frustrating as it was fun.
There is a lot to it that people don't understand when they're just reading the article.
Yeah, and you realize too, like how fragile and how valuable that objective data is when you start to realize all of the things you can do to screw it up.
But you didn't.
No, I worked very hard not to. So,
Did all of this background give you a unique lens or a bias and that shaped how you interpreted the data or even
uh,
acquired it or designed the study?
honestly, I did come in with a huge bias in terms of my preference for needle, at least in TPLOs, because I felt anecdotally, I thought I saw a lot more immediate post-op bruising from the cutting needle. So I had to really work hard to make sure that throughout the whole process, I was as blinded as possible to I was blinded to the needle type when I was gathering my data. And it was surprising finding that, I that anecdotal feeling. I was like, oh yeah, we're definitely gonna have more bruising from the cutting needles. Watch this. And then it was like, oh, there was no difference. And oh, there's more erythema. Okay, sure. Like, was not expecting that. So that was a fun little, oh, neat that I came in with.
It's always cool to see what the evidence shows us.
Yeah.
So Josh, this next set of questions is going to be really important for our listeners. These are our big take-homes. The first one's going to be about the veterinarian's perspective. So what is one piece of information the veterinarian should know about using reverse cutting or taper point needles for intradermal closure during TPLOs?
They both work. Our outcomes for the patients were good either way. We didn't have any significant differences in the complication rates. The nice thing about TPLOs, especially in this population where we really tried to eliminate any confounding factors from like comorbidities, is TPLO patients are usually healthy, happy, young to middle age, dogs that want to go back to ripping and tearing on the ground. So if there's a particular needle that primary care veterinarian or surgeon feels that they have a better outcome with on their TPLO intradermal closures, go for it. Yeah.
Well said. And for the clients, what's one thing you wish more people understood about this topic?
It's not black or white. There's a lot of things in science and medicine where it's easy to form an opinion because of Dr. Google, but understanding there's a lot of clinical discretion and getting objective data is hard.
Thank you, Josh, for being with us. As we wrap up, we like to have a little bit of fun with a few questions. So what is your favorite animal fact? That fact that you dig out when conversation's a little bit at a lull and people are like, no, I didn't know that.
Has anyone ever brought up the mating habits of deep sea anglerfish on the show?
No.
So that's a
Do
really
tell.
that's a fun one. So certain species, deep sea anglerfish are probably one of the more extreme examples of sexual dimorphism in animals, and have a very unique strategy to mating, which has been termed sexual parasitism. So the male anglerfish is significantly smaller than the female. They have there's certain species that are literally unable to eat because they don't have an appropriately formed digestive system. It's completely underdeveloped, and basically they're just swimming bags of gametes whose only purpose in life is to find a female, latch on, and at which point they become embedded to the female permanently, where they'll even start to share a blood supply, and are functionally just a set of gametes that they can use when appropriate.
That's a swimming set of gametes. That's awesome. All right. Well, let's see what you have for this one then. What do you think is the most beautiful animal?
Look up the greater plateau. That one just makes me laugh.
Tell us what I don't know
So
what that
pretty.
is.
The greater plateau is one of the more. It's a common bird in South America. Really interesting looking animal, but I think they're gorgeous. So.
Why? Why do you think it's so beautiful?
Makes me laugh.
Okay, that's fair.
Functional makes me laugh.
Definitely gonna look that up after this. Can you spell it? I'll make sure to look it up.
Potoo.
Okay, perfect. Thank you.
Even the name is funny.
Awesome. Well, thank you so much, Josh. We appreciate you being here with us today and also for sharing your work too with JAVMA.
Yeah, thank you so much for having me. And hopefully I can get another paper or two through you guys in the future.
Awesome. We'll be looking forward to it for sure. And for our listeners, you can read Josh's full article in JAVMA. I'm Sarah Wright here with Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex. And don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.